Today's session, Trauma Informed Care 101, Understanding Your Role in Creating a Trauma-Informed Environment, is all about, well, think of it as an overview of trauma-informed care and how it has been applied across child and family serving settings. The presentation will define trauma and trauma-informed care and discuss the specific steps to creating a trauma-informed approach, highlighting the role that the participants like you can specifically play in the transformation. And with that, I want to introduce our speaker. On the next slide, you'll see a little information about Dr. Lisa Conradi, who is the Executive Director at the Chadwick Center for the Children and Families at Rady Children's Hospital, San Diego. In this role, she oversees all programming at the Chadwick Center, a children's advocacy center, which houses one of the largest trauma treatment centers in the nation. She has significant experience in the field of child trauma and in supporting service systems to become more trauma-informed. She has led implementation of trauma-focused evidence-based practices for children, adolescents, and their families, and the development of resources designed to help systems become trauma-informed. She's a licensed clinical psychologist and is trained on evidence-based trauma-focused treatment practices, including trauma-focused cognitive behavioral therapy, that would be TFCBT, and child-parent psychotherapy, CPP. Dr. Conradi received her undergraduate degree in psychology from the University of California, Davis, and her graduate degree in clinical psychology from the California School of Professional Psychology in San Diego, California. She is co-author of the recent book, Trauma-Informed Assessment with Children and Adolescents, Strategies to Support Clinicians. And with that, Dr. Conradi, we want to say welcome back, and we're so excited about today's discussion.
Thank you, Jess. It's always so wonderful to be doing trainings for Caltrin. I'm so happy to be here with all of you today, talking about trauma-informed care and creating trauma-informed environments is something that's really passionate for me. And hopefully I can share some of that passion with you. I'd like to start this by saying trauma-informed care is one of those things that has a lot of buzz. If you're not in the field, you might be hearing about it. You might even have had family members who don't work in health services or children's services or family services who are asking you about what it means to be trauma-informed. You know, Oprah Winfrey and Bruce Perry just published a book on being trauma-informed called What Happened to You. So it's a really hot topic. And so I'm excited to talk about it, but I also think that it's often talked about as this kind of amorphous thing. And what I'm hoping we can do today is bring it down to the levels where we know what to do. How do we actually create these environments? So here's just a little bit of an overview of what we're going to be talking about today. So first, I'm just going to provide some description, definition of what it means to have a trauma-informed approach. And again, this is something that on the one hand might seem really clear and on the other can be very amorphous. So hopefully we'll dig into that a little bit. Second, what I really want to talk about is what can we do to create a trauma-informed agency? So I took a look at the registration list before this presentation, and we have registrants and participants from all over in lots of different kinds of agencies, in lots of different roles, and actually folks who have a very diverse experience in the area of trauma-informed care. So if you recall, one of the pre-registration questions was, you know, how many trauma-informed care trainings have you participated in? And some of you said, you know what, I'm an expert. I've been doing this for a long time. I've participated in several, 10 or more trauma-informed care trainings, which is fantastic. And I absolutely hope we can learn from your experience in this presentation as well. And then we have some of you who this is your very first time. Maybe you've just entered the field. Maybe you have changed fields, and so you've come into the field of human services, and so trauma-informed care is maybe new for you. So there's a really diverse group. So what I'm going to try to do is talk about trauma-informed care in a way that hopefully is accessible to everybody, but where for some of you, you might be leaders and your role is going to look different. And for some of you, you might be brand new. This is your first job out of graduate school. You're just interested in the topic and you're wondering what your role is in creating a trauma-informed environment. So we're going to do our best to really meet the various needs of the participants on the webinar today. We're going to talk about the core principles of trauma-informed care within the agency setting, and ways in which you can apply these principles within your specific role. I love seeing all the different names and organizations for folks who are joining today. So we have a couple of different polls. And so we're just to get a sense of, we get folks who register and then we get folks who show up. And so I want to get a sense of who we have on the call today. So if we wouldn't mind launching, there we go, the first poll. What type of organization or system do you represent? You select all that apply. So we have child abuse organizations, child welfare, mental health, others. And then I want to see for those other agencies, homeless services, I like to see kind of who they are. So we see CASAs, which is great, daycare. We have students, we have virtual school district, victims assistance, peer support, FRCs, great hospital systems. So lots of FRCs, which makes a lot of sense. Family First Prevention Services. First Five, suicide prevention, early start, CASAs, Kern River, FRC, ICWA. Fantastic. So a lot of diverse agencies. So hopefully you guys get a sense from who's on this. And it looks like about a quarter of you, or I'm sorry, 17% of you are from child abuse prevention organizations specifically. Almost a quarter are from child welfare and exactly a quarter are from mental health. And then we have all the FRCs and the other representation that is on. So that's great. Okay, let's go ahead and let's see. So here's our results. Okay, and then we will go ahead and launch the next one. So this one, we're trying to figure out the roles we have represented here. So organizational leaders, supervisors, frontline, and then if it's an other kind of role, please type that in the chat. So we have CASAs, case managers, student interns, great. Family advocate, policy, resident services, prevention specialist, preschool, site supervisor, residential social worker, an executive director, in-home counselor, social workers. So it looks like about 13% of you are organizational leaders, 16% are supervisors, about 30% are frontline staff, and other, about 41% of you identified as the other. So we have lots of, coordinators of community services and support and home outreach. So a great diverse group of folks that we have on the call today. Great. So I'm going to go ahead and stop that. And then what I want to do is just take a little bit of a step back and talk about where we started here. So I became interested in the field of trauma-informed care several years ago, back in, I'd say 2007, 2008, in part when I was kind of first entering this field. And my entry was specifically in the field of child welfare. So we had a big national grant where we were talking about what does it mean to be trauma-informed in the work of child welfare. So at around that time, there was a big push for trauma-focused services. So if you were a mental health clinician, you were getting trained on evidence-based practices to serve children and families who've experienced trauma. And that's fantastic. So those are things like TIA, trauma-focused CBT, child parent psychotherapy. And we were really thinking about trauma in a different way. And a lot of that arose from 9/11 and a lot of things that happened in the early 2000s. But one of the things that was missing was if you weren't providing trauma-specific services, what was your role? How do you do this work? everybody, what we've learned is that a lot of the folks that we see have experienced trauma. That is absolutely a part of this work. You don't need to work for an agency like mine that is a trauma-focused organization. So for us, 100% of the families that come through our doors have experienced some kind of trauma. That's part of what it takes to come into our organization. But when you work in juvenile justice, child welfare, schools, community, family resource centers, the chance that the families you're serving have experienced trauma is very high. So I wanted to start just by anchoring us in trauma and what I mean when I talk about trauma, because one of the things I've also seen as we are is trauma has become a very popular conversation topic. You go on social media, you see a lot of folks talking about trauma, and it's become very broad. And I think it's great that we have this conversation about trauma, but I also think that in some ways it's getting distilled. So when I'm talking about trauma, and I'm talking about individual trauma specifically, I understand there's system trauma, racial trauma, historical trauma. But when we're talking about individual trauma, this is usually an event or a series of events or circumstances where the individual experiences physical harm or threat of physical harm that they experience as being life-threatening. And this sets your system and your body, your physiology into a whole fight-flight response that fundamentally changes how you see and experience the world and how you connect with others and form and maintain relationships. So it can impact you across all types of functioning, so mental, physical, social, emotional, and spiritual. Trauma is not a stressful event. It is beyond a stressful event. There is room for stressful events in our lives. It's going to happen to all of us where something scary or bad happens, where there's divorce, where there's loss. Trauma is something specific and different from that. It is something that fundamentally changes who we are. It's not something we just bounce back from after the event is over. And in most cases, that's what happens with stressful events. So with that kind of anchoring and definition, I'm wondering if you guys could just put in the chat the kind of experiences or events that you might that might be considered traumatic based on that definition. Witnessing a death, absolutely. Loss of a loved one, homelessness. I'm seeing things like car accident, rape, child abuse, emotional abuse, sexual assault, domestic violence, system trauma, entry into foster care. And so I want to make a specific comment about things like divorce and ACEs that have been mentioned. And I think ACEs is a really interesting, it's very common. Many ACEs are absolutely traumatic, but many are considered kind of stressful or adverse events. So things like divorce, things like mental health issues with a caregiver. It doesn't mean that you're not vulnerable to trauma. So a divorce can go really bad and actually be traumatic, but not all divorces are traumatic. Whereas when we think about things like sexual abuse, those are the types of events that everybody's going to have some sort of response to those. So I just want to make sure we're clarifying that when we're talking about trauma, we're talking about these events that are absolutely life-changing, because it really does. I think when we talk about it in the general conversation, it gets a little confusing, which makes a lot of sense. So thank you guys for that. That's fantastic. Okay, so now when we talk about trauma-informed care, it means that we as providers understand that the families we serve have likely experienced some kinds of traumatic events. We know in child welfare, we know in mental health that often our families, and I'm going to say 70% and above, based on all the research that occurs, have experienced some kind of trauma, and that we create environments in our agencies that understand that prevalence, and we create environments that promote safety, healing, and recovery rather than inadvertently re-traumatizing. And how we do this work matters, and how our front desk staff greet patients when they come in matters, how our therapists greet patients matters, what it looks like when I pass a family in the hallway at our agency here, because at my agency across the hall there is the waiting room for the services. So what does it mean when I'm passing a family in the hallway? And so when I'm talking about creating a trauma-informed environment, it's all of those things. It's the pictures on the wall. It's all of the micro interactions. So a lot of this is based on the work that's been conducted by the Substance Abuse and Mental Health Services Administration. We call it SAMHSA. Back in 2014, they created something called the 4 R's. And they're actually, I just came from a meeting at SAMHSA last week. They are doing some updating to the 4 R's, and they're putting out some more resources on trauma-informed care. So that'll be really exciting when that comes out. But the 4 R's are essentially, the first is realization. So all people at all levels of the organization have a basic realization about trauma and understand how it can affect our families, groups, organizations, and communities, as well as individuals. So for us, that means we might make sure every staff member goes through a Trauma 101 training, right? And goes through a training like this. So just to make sure that we understand trauma is we're swimming in the water when we're here, no matter what your role is. 2, that we recognize the signs of trauma. So when our families come into the waiting room here and they're irritable, they're angry, they're depressed, they're sad, that there's a lot going on with our families, and it's possible that some of their behavior is a result of their own history of trauma, right? And understanding that there's a lot that happened to a family before they came through our doors. And what we don't want to do is exacerbate that or make it worse for them. That we also, as an organization, respond by applying the principles of a trauma-informed approach across all areas of functioning. So again, it's not just in the therapy room with one of our fantastic trauma-focused mental health providers. It's with every interaction. It's with our family advocates and case managers and our parent partners and our front desk staff and our folks who work on things like Caltrin, who pass our families in the hallway, right? So it's everybody in this organization. And that the approach is that we seek to resist re-traumatization of clients as well as staff. So we are meeting the needs of our staff members at the same time we're meeting the needs of our clients, which is trickier than it might sound. But what you don't see here is providing trauma-focused mental health treatment, right? Because unless some of you might, almost a quarter of you are mental health providers, and you might be providing that work, and you're already providing trauma-focused service. But a lot of this is about the big picture. What does it mean across the agency? Not everybody is providing that trauma-focused treatment, but we all play a role. So really, this is a great visualization that I'd like to credit Trauma Informed Oregon for creating. And really what they're talking about is that for the foundations of trauma-informed care, on the one hand, there's a commitment to trauma awareness. So we understand across the organizations and systems within which we work that trauma is prevalent among our population, but we also understand the impact of historical trauma and oppression. So I'm looking in the chat, I've seen things like police violence, deportation, immigration related trauma. Those are all absolutely at play. And one of the things, we're what's called the Children's Advocacy Center, which means we have law enforcement that comes in and might sit in our lobby. And what does it mean for some of our families to have law enforcement come in if they've had a history of police violence? What is it? How do we create a safe environment there? So these are the kinds of conversations that we're having in order to create a trauma-informed environment. So agencies that do this are really committed to trauma-informed care, have policies, procedures, and practices that, one, they prioritize creating safety through physical safety, through creating trust, and we're going to talk about all of these, boundaries, transparency. So we are upfront with our practices and our expectations. We create predictable environments, and we give opportunities for choice when that is available to us. And we also have the opportunity to restore power through choice, again, empowerment, a strengths-based perspective, and skill building. And we build self-worth through relationship, respect, compassion, acceptance and non-judgment, mutuality, which means we're in this together, and collaboration. We're not just in it together, but we're working together to identify better solutions. So we're going to break these down, but I thought this was a nice way to lay out the overall thinking. So what is a trauma-informed approach? What we have here are the 6 principles that SAMHSA has developed that really highlight this trauma-informed approach. So the first is safety. When they're talking about safety, they're talking about physical safety. So not be, no threats of physical harm, right? You can walk into a space and you know that nobody's going to physically hurt you, which we would hope, sometimes could certainly be at risk at some of our organizations, right? But we're also talking about psychological safety. And the best way to think about this is that I and who I am as an individual with my unique characteristics, my unique identifiers, my cultural context, I get to show up and be who I am, whether that's my racial and ethnic background, my socioeconomic status, my gender identification, that I get to show up and be who I am, and I'm not at threat for psychological harm, right? And we want to create teams that are psychologically safe for our staff members, but we also want to make sure that all of the families, no matter how they identify, are able to come into our spaces and know that it's a welcoming environment for them. Now, I will say, this is probably the most important thing to create a trauma-informed environment. It's hard to do anything if you don't feel safe, but it's also one of the easiest things we can do. Walk around, do an environmental scan. Does your space feel welcoming? No matter what your role is, you get to help create that space, make suggestions. Hey, maybe we could put some pictures up. Maybe we could put the rainbow up, and it's not just during Pride Month, just so families know that we are an accepting and safe space for them. The next principle is trustworthiness and transparency. This means that I do what I say I'm going to do. I'm reliable. I don't promise things that I can't do. Tell me, as a healthcare provider, in whatever role you're working with families who have so many needs, and sometimes we want to promise things. We promise it's going to be okay. We promise we're going to be able to get them into this housing. We can't do that if we're not going to be able to make it happen. We don't guarantee anything, right? But we do promise the things that we know we can do, right? And so making sure that we are within our scope as providers and that we do what we say we're going to do, because there's a great way to lose somebody's trust is to promise them something and not be able to deliver on it. A lot of our families have been made promises many, many times before, and they've just been let down by them. And that means you're being transparent. So I've said to families, I would love to be able to promise this to you, but I can't. What I can promise to you is that I'm going to do my very best, and I'm going to call this person, and this person, and I will keep you posted on what I hear back, right? So being fully transparent and creating that trust. The third principle is what we call peer support. So really having folks with lived experience who are part of the process. It's way easier to, often families coming into an official professional office, meeting with somebody who has all these degrees after their name can feel so separate. It's like, how do you understand my experience? There's so many good programs that rely on a peer support approach, and that's really critical because families need to know that somebody has been in their shoes and has seen a different outcome. And once we are able to plant that seed, then we're able to actually nurture it and watch it grow. The fourth principle is collaboration and mutuality. So we're working together. It's not me instructing you on what's going to happen. It's us identifying the path forward together. Empowerment, voice, and choice. One of the things that happens within trauma is that our choices, our power it's one of the hallmarks of trauma is that is taken away from you. So when you are, if there's somebody who's been sexually abused, their power, their body autonomy has been taken away from them. When you're a natural disaster and you've lost your home, your power over something that you thought was going to be there forever is gone, right? So folks have fundamentally lost control and power over their own world in that moment. Now, as systems, we can't promise and let them have all the power, right? Especially when you're working in systems with law enforcement and juvenile justice and legal, right? There isn't, but there are opportunities for choice, and we identify when those are. And sometimes in trauma therapy, it might mean today we need to do 3 things. Which one do we do first? And that's the choice that the family gets to make. So however we can identify choice is important, even if it's not across the board. And finally, none of this can occur without the context of culture, understanding historical context, as well as gender issues. And so really, I would see cultural, historical, and gender issues being kind of the circle around the rest of trauma-informed care. That nothing happens without these things, that we must look through everything within this lens. And there's definitely a push and a movement that trauma-informed care doesn't exist without anti-racist policies and principles. And so I would certainly agree with that and think everything needs to go through those lenses. So there's a lot of benefits to a trauma-informed approach. And this is a list that was created by the National Council for Behavioral Health. This was 10 years ago. Nothing's really changed here. We know it's a proactive approach to physical and emotional safety for clients and staff, that it is an opportunity to create and sustain choice, power, and control through our interactions. It decreases the stigma of trauma and mental health concerns, reduces the possibility of re-traumatization, improves the social environment in which we interact in all of our relationships, creates environments that care for and support staff. Remember, staff are very much a part of this. Increases the quality of services and reduces costs ultimately. Reduces the number and types of negative encounters. So a lot of this work started trying to minimize seclusion and restraint within residential facilities and inpatient psychiatric hospitals. So how do we do what we need to do without having these kind of negative encounters? I've worked in a psych hospital. I know I've had situations years ago when kids were in seclusion and restraints, and you hear them screaming. That's not a very trauma-informed approach, and I'm really glad that we've moved beyond that when we can. Creating resilience and a strengths-based focus, as well as increasing client and family satisfaction. Folks are just happier with the services because they feel seen, heard, and trusted. And staff feel like they're doing something really good. So as a leader, I'm always thinking about staff retention and staff well-being, and this helps get us there. So the way I think about when you're talking about creating a trauma-informed agency is there's kind of 4 steps. We're gonna do an overview of these, but we can dig in more with some of the specific steps depending on your role. So you'll kind of see it starts at the top with the culture shift at an organizational level, and then goes down to creating that safe environment, addressing secondary trauma, and then implementing tasks within your organizational scope. So first, creating a culture shift at an organizational level. So I'm a big fan of thinking about organizational culture and climate. There's a whole bunch of literature on this. If you are interested in this, I highly recommend that you check out some of the great resources. But essentially what an organizational culture is that it's the implicit norms, values, and shared behaviors and expectations and assumptions of an organization. So simply put, it's the way things are done around here. What is our culture? And you can have culture on your specific teams. So our organization has around 100 people, and it also has 6 to 7 different teams. each of those teams has its own unique culture. And then we work on trying to create an organizational culture here at the Chadwick Center. And then we are part of a larger umbrella organization of Rady Children's Hospital. And we try to create a culture there as well. Culture is shaped by a host of forces. And it's changed by leaders. And when I say leaders, I'm not just talking about those of you who identify as executive directors or program leaders, although that is very important. The other folks who shape the culture are those more informal leaders. And you know who I'm talking about. They're the ones that, even if they don't have a formal leadership role, everybody listens to them. They have a lot of power, even if it's not official power, that people respect them, they rely on them, and they steer the course, right? And it's great if that person is in alignment with you as a leader. It's problematic when they're not, right? And so how do we work with these various leaders, informal, informal? And the other thing I want to say is, if you're on this and you are not in an official leadership role, you absolutely still have so much capacity to help change and inform the organizational culture. And what I would say to you is, think about the kind of culture that you want to be a part of. And if you're new to the organization, don't get swept up in maybe if there's a negative culture going on, don't get swept up into it. Cultures can change. I've seen it happen with my own eyes, and I absolutely think we all play a part in that. So I love this video. I'm going to share it with you. And then we're gonna talk about it.
Whoa, that's not good.
Oh, I don't need this. I'm already late.
Somebody will come. Anybody out there?
Do you have a phone?
No. Sorry. Somebody! Hello? There are 2 people stuck on an escalator and we need help. Now, would somebody please do something? I don't believe this. You gotta be kidding me.
I'm gonna cry.
Well, there's not enough left to do, is there?
Hello? Hey, don't worry about it. I'll fix it in a second.
He said he can fix it. All right. All right. That's more like it. He says he can fix it.
So I've seen a lot of fun emojis come up on the chat. I think you guys are probably responding the same way I did. 1, it's a funny video, but 2, how often have we felt stuck in a situation when we looked at it from a different perspective? We realized the solution was a lot easier, right? And for them, it was just walking up the escalator, but they were stuck in a culture where they were expecting the escalator to work for them and to meet their needs. And when it no longer did, they freaked out, right? And what I would invite you to do is think about the organization you work for and what are some of the expectations or norms that you've just taken as that's the way it is, or that your employees are taking as just the way it is. I love this Wayne Dyer quote just got posted in there. If you change the way you look at things, the things you look at change. I think that's beautiful. It's not the situation, it's how we handle it, right? So I think really inviting you to think about your organizational culture and that we all play a part in it. And when we talk about becoming a trauma-informed environment, becoming a trauma-informed agency, our work has to happen within the context of an organizational culture change, right? And so, and it's anytime we're talking about changes within organizations, it can be uncomfortable. I can't tell you how many times we've worked really hard to create changes that were absolutely necessary and everybody wanted and everybody was happy to see. But when the change occurred, it created a lot of discomfort. So there's also this period of time as we're doing this work where people are going to feel uncomfortable, you included, and we have to sit in it. We have to, it's kind of the forming, storming, norming, for those who are familiar with that we get all excited when we start a new initiative. And then we start to kind of debate and fight and work out the kinks, and it can create conflict and uncomfortable conversations. And then after a period of time, it settles into a new norm. So anytime we're talking about these kinds of shifts, and that means challenging, historically, nobody in the near past, but we've had staff members who work at our front desk who were not welcoming. And when we called them on it, they weren't happy about it, right? And they had a different approach. They no longer work here and haven't worked here for a long, long time. But it's those sorts of things that happen when we try to make these transitions. So when we talk about it, you have to be ready for the change. So organizational readiness. A resilient organization is able to adapt and thrive in times of uncertainty, pressure, ambiguity. Succeeding as an organization is much more likely when we build resilience into our strategy, culture, and day-to-day practices. So we support individual resilience. So we create a culture shift across all aspects of our programming, settings, relationships, atmosphere. It's not just adding a new service or adding some language. One of my pet peeves is when nobody changes what they're doing, but then they say they're trauma informed. I'm actually more comfortable when they say we're working on it, but you don't just get there and you're done, right? It's a process, and you can't just put a stamp of approval that it's done, right? And so we really want to get in there and make those changes. It involves all groups, and it means a new routine, a new way of thinking and acting. So it's not just a new policy. So some of the things that can come up when we're talking about a culture change is, one, we can do trainings. Trainings are great. I love doing trainings like this. I think it serves a purpose of getting people excited and wanting to make some changes. But if you as an organization said, okay, you're sending everybody to this Caltrin training, and then we're going to be trauma informed, that's not going to work, right? Train and pray is kind of what we used to call it. You can't just train and then hope things change, or that we create check boxes, or that we do a practice change without actually changing people, because people will revert back to the previous practices. So how do we actually deal with it? One, we have leadership commitment, and I'm not talking, hi, I've stamped my approval as a leader, you guys go forth and do it. I'm talking about leaders showing up. I'm a leader. I know how busy it is. I run a big agency. You got to show up. You got to show up to the meetings, maybe not all of them all the time, but you have to show and dig in, because then people will know it's a true commitment. We prioritize people rather than products. We educate on culture change. So even talking about, hey, it's going to be exciting at first, and then we're going to have 6 months where it's going to be hard, and then it's going to get better. And so, when we go through this, I've said to more than one staff person, right now you're in the storming. Let's continue talking, but also in 6 months, I promise you it's going to be different. And it is, right? And then we have transparent communication. So we're really upfront about it. And that's how we can really change culture. So strategic ways to create organizational change. So incorporate things like the implementation science principles. So if folks are familiar with the EPIS model, it's a model of implementation science developed by Greg Ahrens back in 2011. It stands for exploration, preparation, implementation, and sustainment. There's a whole literature on it. So dig into implementation science, training for all staff, and then some specialty training for leadership to embed sustainability, integrate the use of champions during the rollout process, use of organizational culture assessments, a train the trainer approach to having folks that they're champions, they're wearing this hat and they know this better, and they're the person that you can go to. It can't all be on one person, right? It's a team. Don't pretend it will be easy. And in fact, identifying anticipated barriers up front can actually help you get over those barriers easier. And I was curious if anybody had other things they've used to implement organizational culture change, and if you wouldn't mind typing those into the chat. I'm sure those are going to be coming in. I'm going to move on, but I would definitely invite you to keep reading the chat so you can see that. So I see Train the Trainer. Others will pop in, but there's some great suggestions, I'm sure. Okay, so the next one, is really creating that safe environment for staff and clients. So again, I was talking about the difference between physical and psychological safety. So physical being that freedom from physical violence, and psychological safety, your ability to be your own identity and feeling safe with other people in your community. And the important piece about safety here is that I want you to think about a time when you've been on edge, scared, nervous, something happened and you maybe felt profoundly unsafe. When you're not feeling safe, you're very much in a reptilian brain. There's not a lot of thoughtful, cognitive, like processing, planning going on. It's very much about survival, right? So when we're in survival, we're not able to step out of our own space. We're not able to show up in a way for others. And so the reason we need to make sure everybody feels safe is that's when the work can actually happen. So often we work in reactive environments where things are coming at us all the time and we don't have time to plan, right? And if we're not able to do that, we're going to constantly be reactive, constantly be stressed. And then we're not going to be able to necessarily always be thinking about the best ways to provide services and to create that safety for our families. So really trying your very best. I know clients keep coming in, funding concerns keep coming in, crises keep coming in, but trying to create a space where you can take a step back and actually get out of that reptilian brain and into the planning cognitive brain. So when we talk about safety, it plays a critical role in trauma and adversity. Yes, you will. I've seen the question in the chat about the links for the videos will be available. Individuals who've experienced trauma and adversity may have valid fears about their own safety because their safety has been compromised often multiple times, or the safety of a loved one, right? So that's, again, another hallmark of trauma. And as a result, they have difficulty trusting others to protect them. So whether you're talking about your staff or you're talking about the clients that come in who you're providing services for, they may not trust you. In fact, they probably aren't going to trust you when they first walk in the door because over and over again, they've had their sense of safety violated, right? These are folks who are also very good at attuning to potential threats, whether they are realistic or not, right? And so they're constantly scanning the environment. In psychology term, we call it hypervigilance, but that's essentially just looking around all the time, looking for some sort of threat to their safety, right? And so when you're doing that, again, you're in your reactive reptilian brain, constantly on edge, versus being in your cognitive, thoughtful brain. And that's when the work happens. So as providers, helping families, no matter what your job is, helping them sit down, create space for safety, saying, my job is to be here and present for you. I understand that this is a scary place coming in here for the first time. This takes time. And I'm committed to building your trust and doing what we can to make sure this is a safe place for you to be, right? You say it out loud, you put it out there, you use the language. And I know I've kind of given some of that in trainings before, and people go, oh, everybody's talking about safety, and my clients have not responded well to that. You know what your clients need better, but what I would suggest is that you put the language out there, you call it out, and you be transparent in whatever way is going to resonate with the families you're serving. And folks who've had trauma also have a hard time controlling their responses to perceived threats. So often some of the concerning behaviors we might see are reactions because there's a reminder that is that's eliciting that kind of response, right? And so we want to be aware that our environment, there could be something about me that is potentially a reminder for them of their trauma. So we want to be aware that often the responses are more information about what might actually be, I don't like the word triggering, but what might be eliciting that kind of experience. Trauma reminders. So again, when faced with people, situations, places, or things that remind them of these events, they may experience it as intense and disturbing, and it's tied to the original. So it's almost like they're re-experiencing that same trauma, and they lead to behaviors that seem out of place in the current situation. So the old example is a child who in the classroom starts talking back to the teacher and being really reactive. And they might be triggered because of the fight they had with their dad yesterday at home, where they felt really unsafe, right? So something about those experiences felt the same and triggered the same reaction, even though they're completely different people, completely different situations. And at the time during the trauma, these responses might have been helpful, but out in the rest of the world, they're not. So in the example I just gave, that child in the classroom, it's not helpful to talk back to your teacher in that way. But the night before, it might have saved you or saved your sibling from being hurt by a parent, right? So things that are helpful in one situation aren't later on. So what I love about this video, and some of you might have seen it before, it's a Brene Brown video on empathy versus sympathy. And really, it's not always about what you say. It's about the ability to be present, and people know it. People know when you're connecting and being present with them. So I'm going to share this video, and hopefully this will kind of elucidate what I'm trying to share. So here's the thing I love about that video, and hopefully some of you have seen it before, is that nothing she was talking about is a therapy intervention. It certainly occurs in therapy, and as therapists, I hope that's how we're sitting with our families. But it's a reaction anybody can give. It's being present in the moment. It's our front desk staff. It's walking down the hallway. It's a smile. It's understanding that our families are coming in with a lot of stuff, and that we are aware of that. And that's a hard place to be. And that's why attending to things like burnout and secondary trauma are so important. And so that's part of your role in creating a trauma-informed environment we're going to talk about. But I will say, most of the time, it's not the connecting that wears people down. It's all the other stuff in the organizational culture. So if we're able to really create a space where we can meet with our families, where we can understand where they've been coming from, even if we haven't personally experienced it, there's nobody that we're going to exactly have the same experience as, but we understand what that sense of loss and fear is, and that they're coming in with that. One of the things I tell, we have a new staff orientation every quarter. One of the things I tell our new staff is families that are coming into our waiting room today might very well be the worst day of their lives, right? Because to come see us, your child might have disclosed abuse to child welfare yesterday, right? And then they're coming in for services here today. And your whole family has been torn apart because there was an allegation of abuse against a loved uncle or a loved parent or caregiver, and everything is getting torn apart. They are in the most vulnerable space. And what we want to do is make sure we're holding them in that space, no matter what it feels like. Just because they can't show up smiling, being on their best behavior, being the most friendly, doesn't mean that we need to respond the same way. We need to respond in a place of warmth and connection and caring. We don't need to hear their stories right then, but we need to know that the space that they're holding when they come in matters. So here's some tips for promoting that safety, right? Depending on your role, this might look a little different, but one is share as much information about what will happen. We know knowing what to expect helps people feel safe. It's the unexpected that freaks us out. Don't make promises though. So share what you know you can. Provide as many opportunities as possible for clients to have control over the situation. Be transparent about all decisions. I will tell you, clients who feel like they're not being told what's going on or decisions were made without them, that is the best way to get them completely disengaged from your service, no matter what your role is. Actively integrate them into the discussions. And I know this is hard. I know we deal with clients who've had a lot of hard experiences, and as a result, how they show up for us can be really difficult, and that could trigger things for us, right? I understand that, and that's where we need to do some self-reflection, because at the end of the day, it's our families that need the services, and we are doing this for them, right? So how do we as an organization create a culture that allows that to happen, where I go, oh my God, that family was hard for me. That was hard. Let's talk about it. And that's okay. Be very clear about the next steps, share information in multiple ways. So you guys are on this training today. It would be completely unrealistic for me to expect that you're going to remember everything I've said on this training, and that's it, right? So maybe you'll learn some of it. You'll walk away with some pieces. You'll like the Brene Brown video, and you're going to want to go share it, right? But having it in writing, watching it again, if there are things you wanted to revisit, right? We don't know. We can't share all that information and expect them to walk away knowing everything. And I can't tell you how it's a pet peeve of mine where they're like, well, I told the client this. And I'm like, yeah, you told them that on the worst day of their life. They weren't taking in a lot of information. I think it's important for us to call the next day and check in with them and provide the information again, right? That's the trauma-informed response. And I love this in the chat. This applies to supervising staff as well. We don't know why they are reacting to situations instead of responding. 100% Carrie, I agree with you. And finally, assess your environment for physical and emotional safety. There's some great free self-assessments. You can Google actually trauma-informed agency self-assessment and come up with some, there's some great ones that have been developed, and walk through those and really do that environmental scan. I'm going to go ahead and skip over this because we've got a little bit more to cover, but I just want you to reflect on ways maybe you've created safety in your environment. So the third step is addressing secondary traumatic stress at the individual and organizational level. Like I said, this is critical for supporting our staff to really show up and be in the space that they need to be in to support our clients. So when we talk about secondary traumatic stress, there's kind of two kinds of strategies. So one are these individual strategies, and this has historically been how we've talked about secondary traumatic stress. So this is, as providers, here's what I need to do so that I am able to do this work. So this is them, this might be your staff managing the work themselves, identifying areas that bring them energy. So it's not always, I'm going to go and do yoga after work. There's usually something they love about the work itself during the day. I love doing webinars like this. This creates a lot of energy and enthusiasm for me. This is going to carry me through the rest of the day, even if I have to have a difficult conversation later on, right? So what is it about the day that brings you energy? And then and then also thinking about self-care, right? So your yogas, your meditations, it can't only be about that, but we all deserve to have space where we can attend to our own self-care needs, no matter what our role is, right? So that's one part of it. But the other is organizational strategies. So organizations have a responsibility for creating a culture and climate that supports health and wellness. And that means saying this is hard work, and we're all going to need space to talk about these tough clients, these tough situations, and it's completely okay. You're not going to be judged on your performance about it, that we're actually going to create space within our work to allow for that. And that burnout occurs often not because of the families we serve. I hear this over and over again, like all the research. It's tough serving the families, but it's, oh my God, so annoying when I can't get this thing approved so that I can provide this family with this resource, or the copy machine keeps breaking and all I want to do is print something for the families, right? Those things actually stress our staff out more than the big types of families that we serve. So I also recommend you look and say, what are the things that are really annoying to staff? We do like a visit to all the teams and we talk about like, what's the thing that's bothering you? And it always surprises me because it's always something like this little bit of communication isn't happening, right? Those are things we can fix. So eliciting that information, addressing that, and that can actually help mitigate some of these secondary traumatic stress. Shifting our perspective, it's changing from what's wrong with our system to what is happening and what gets us through. One of my favorite quotes is every system is perfectly designed to achieve the results it gets. It's a big implementation science quote. And I invite you to think about it because our systems function a certain way. And so a lot of it is about our perspective and what are things that are helping us get through. As an organizational leader, I've been here a long time and I've seen changes and things people used to be really frustrated about 10 years ago might be solved. And I like to just remind us that we've come a long way. Things that were problems 5 years ago aren't a problem anymore. We're through the pandemic. There's impact, there's all of that, but we're not in the middle of it. I will always remember what March 12th, 2020 felt like. I'm really glad we're not there. We're in a lot better space than we were then. And so perspective, what's getting us through versus everything that's currently wrong. Other organizational resiliencies, sense of humor. So laughter, if there's some things you're either going to laugh or you're going to cry, right? Laughter is okay. Doing it in the right place, not talking about clients where clients can hear you, all of that. But sometimes we gotta laugh. Celebrations and joy, create that space, reflection spaces and rituals, leadership showing up, capacity to adapt to a changing environment. Change is the only constant. It's going to happen no matter what. And prioritizing our employee well-being, succession planning. We need to have a succession plan. Gone are the days where leaders are going to be there for 30 years and you don't need to have a backup plan in place, right? Things are changing constantly. We need to think about having an environment that is okay with a succession plan. Staff diversity being celebrated and staff's commitment to the organization's mission. How can we keep anchored in why we do this work? So here's a nice video. This highlights something called the secondary traumatic stress. It's an organizational assessment that was developed by the University of Kentucky. So if you're interested in looking at secondary traumatic stress at an organizational level, I wanted to show this video to talk a little bit about STS, but also to introduce the STS IOA.
Indirect exposure to trauma is an occupational hazard for those working with individuals who have experienced trauma, including health and mental health professionals, child welfare workers, and first responders. Exposure to other people's trauma can cause intrusive thoughts, a rehashing of traumatic stories, distorted thinking, and mood changes. Together, these symptoms are called secondary traumatic stress, affecting 15 to 50% of workers. STS risk factors include how much trauma a worker is exposed to, the type of work they do, their risk factors, and life experiences. STS can lead to significant distress and even post-traumatic stress disorder, a serious condition. To guard against STS, workers who are exposed indirectly to trauma must do what they can to take care of themselves. But self-care isn't enough, and there will always be an elephant in the room. That is, what's going on in the organization. When exposure is high and stress isn't managed properly, it not only hurts the individual, but also creates pressure on the organization. Effects can include high levels of staff turnover, low levels of productivity, low job satisfaction, and absenteeism. To protect against this, organizations need to protect and care for their workforce. But until recently, it hasn't been clear on just what organizations need to do to reduce STS among staff. Dr. Ginny Sprang and colleagues developed the Secondary Traumatic Stress-Informed Organizational Assessment to guide employers through the process. In collaboration with Dr. Sprang's Secondary Traumatic Stress Lab at the University of Kentucky Center on Trauma and Children, the STSIOA is being used all over the world to create trauma-responsive and secondary traumatic stress-informed organizations. The Secondary Traumatic Stress-Informed Organizational Assessment measures workplace stress in a way that's comprehensive, nuanced, and data-informed. This revolutionary tool uses structured questions to determine how STS-informed an organization is and how well they address secondary traumatic stress. This is an essential goal for becoming trauma-informed. Everyone in the organization has the opportunity to give feedback on how STS is managed and what changes should occur. These recommendations drive the ongoing work of the organization through learning collaboratives that structure the change. Using dashboards and color coding, the tool visually flags any urgent considerations that require prioritization and highlights the organization's strengths. The tool is used to develop a blueprint for intervention and to track improvements in managing STS levels, so strategies are data-driven. The outcome of projects driven by the Secondary Traumatic Stress-Informed Organizational Assessment is to keep workers well so they can better help people affected by trauma, and to increase organizational resilience, which benefits management, workers, and those they serve. For more information on how to use these tools to become STS-informed, visit this website, www.uky.edu/CTAC.
So the STSIOA, they do have like a big learning collaborative, but you can also go, you can download that, you can share it with the organization, you can go ahead and do it, it's free. So I recommend that you take a look if that's something you might be interested in. We're going to go, if you have ideas, go ahead and type them in the chat, but we're going to go ahead and move on to our final step 4, implementing tasks within your organizational scope. So there's several core principles, kind of the trauma-informed core principles, and these are kind of, let's talk about what these look like in action, and each of you, depending on your role, might do something a little different. So the first one is just some general core competencies on understanding trauma and stress, right? So doing trainings on trauma, that is common, stress, understanding the difference between positive stress and toxic stress, looking at reactions, so some of what we've talked about today, and also understanding that trauma can be overcome effectively through treatment, relationships, and personal practices. We have data that a lot of this stuff works, right? Trauma treatment works. Creating a trauma-informed environment works. It helps our families feel better, helps our staff feel better, right? So as an individual, work on increasing your understanding of trauma. There's some great trainings on Caltrin about trauma and how that might impact your work. And then From an organizational perspective, making sure your staff have this kind of training as well, but also making sure there's informational materials like brochures, posters on the impacts of trauma and stress readily available within your organization. So we've got brochures that we just actually updated that provide this information. Second principle is compassion and dependability. So we're constantly striving to act compassionately through our interactions with others and through genuine expression of concern and support. We value relationships. So relationships are where all the healing happens. Often trauma occurred in the relationship and it can only be healed through relationships. And the therapy relationship is just one of them. So mutual respect and attunement, but also just communication, promoting dependability and creating trust, which we've talked a lot about here today. So some of the strategies: as an individual, treat yourself with kindness, gentleness, support, and increase your capacity to be dependable by being optimistic about what's achievable, right? When you're coming in going, nothing's going to change. We try stuff, it never works, right? That only keeps the loop going. I'm definitely a glass half full person. I couldn't do this job if I wasn't. From an organizational perspective, cross-train staff and have succession plans for when there's staffing shortages and changes. When people feel like they can't be out because there's no backup plan, that's not good. That's like a number one straight shot to burnout, right? So we need to make sure that people feel like they can take those breaks and they're not going to be called when they're on vacation in Hawaii because something happened, right? Also maintain consistency in practice and policy. When changes are needed, make sure staff and clients have been provided with enough notice. Safety and stability, minimize unnecessary changes, create those environments. But we also maintain healthy boundaries, manage conflict appropriately in our relationships with others. We have those hard conversations when we need to. From an individual perspective, take a look at a professional boundary that you could improve, right? Are you logging into your email at 8 o'clock every night and that's creating stress for you? Look at that boundary. Schedule meetings and events with a 30-minute cushion. I laugh at this because I keep saying I'm going to do this and I haven't done it yet. So I'm right there with you. We still have some work to do. From an organizational perspective, have transparent decision-making rules for meetings, projects, and products. And do environmental scans to identify needed repairs, cleanliness, have family members walk through. We have safety committees, post results. So really being transparent about that. Collaboration and empowerment, recognizing the value of personal agency and understand how it supports recovery and wellness. Preparation, provide information and support the development of skills that are necessary for effective empowerment. And then offering opportunities to make decisions and choices that have a meaningful impact on their lives. So really providing those opportunities. Some of the individual, build connection, learn about the work of other colleagues and departments, learn about and understand stress responses of those on your team. Organizationally, create opportunities for participatory decision-making, and have just a general policy and procedure. Lay it all out there and be transparent. Cultural humility and responsiveness, core competencies, understanding differences, how specific and cultural groups may experience, react to, and recover from trauma differently. Humility, we're always learning, be proactive and responsible for seeking out learning opportunities and learning about different groups, learning about your own implicit bias and cultural humility, and being responsive so we can easily access support and resources for sensitively meeting the unique social and cultural needs of others. And in action, reflect on ways your specific culture, social and racial identity informs your thinking. Increase your knowledge of implicit and structural bias, racial justice, racial equity. And as an organization, value diversity, practice inclusive behaviors, make sure your staff represents the families that you serve, and look at doing things like assessments for how culturally responsive you are, just to make sure you're staying on top of it. And then finally, resiliency and recovery. Core competencies recognize the values of instilling hope by developing a clear path towards wellness. Strengths, identifying and applying strengths to promote wellness and growth. And practices, so we are aware we have access to effective treatments, skills, and personal practices that support resiliency. And on an individual level, find wellness practices that you can integrate into your life, fit your style. Acknowledge and highlight practices that have sustained you. So really call out the things that have worked. Promote a culture of learning, appreciation, and celebration. Acknowledge STS, maybe look at doing something like the STS IOA, and create mini retreats to offer wellness resources. And then thinking about the next steps, one of the things I just want you to reflect on is there was a lot of information. We're going to make sure you get the slides. So a lot of the specific things that I outlined, you'll be provided with that. But think about how this applies to your agency. What are some areas that your agency does well? What are some areas that are challenging? And I always suggest creating a elevator speech as to why your agency should become more trauma informed. Share those with your team and your leadership. So finally, some resources. Some of my favorites are the National Child Traumatic Stress Network and ctsn.org. Have a lot of resources, including the Trauma Informed Organizational Assessment. Trauma Informed Systems, Trauma Transformed up in Northern California. SAMHSA's information on Trauma Informed Approach, information on the Adverse Childhood Experiences Study, and then at the Institute of Trauma and Trauma Informed Care at the University of Buffalo. So with that, I know that there have been some questions that popped into the Q&A. This is my information, but you are going to receive information from Caltrin. So what I'm going to do is actually, let's take a look here at the Q&A. I think that questions were answered, so I don't know if there's other questions that are coming into the Q&A.
Not seeing any questions in the Q&A myself, but for participants, if you do have a question, you're more than welcome to drop it into the chat, or you can use that Q&A feature, and we've allocated some time to address those questions.
Thank you, Mercedes. It's a very nice comment. I appreciate it.
How about this? If you don't have a question, if you feel like the content that was covered and all the resources that were provided were exactly what you came here for, why don't you give us an emoji? You could give us a thumbs up, you could give us a heart, let us know. Wonderful.
I love those emojis. It's really fun how they've like
Me too.
adapt. So now you see these hearts and thumbs up floating. That's super cool. Just love them. What advice do you have for those who may not be trauma-informed teachers and you are working with a youth who has experienced trauma? Any advice on redirection? This is a great question, and I think that many folks will probably have a similar question. One is do some research and get some resources. So one is the National Child Traumatic Stress Network has a lot of resources on trauma-informed schools. There's presentations, PowerPoints. So if you're in a school setting and you just want more information on how to have conversations, there's tip sheets. So one is just start there and get some information. But the other is I like to just start by introducing some of the idea. So, I was talking and I understand that this child has had some really scary things going on at home. I was doing some reading, and a lot of what we're seeing could be because of those. Have we ever thought about what it might mean to be trauma informed as a school? And just starting to ask questions. I'm a very big fan of using curiosity to initiate a conversation. And then you can have those resources in your back pocket so you can share, because my guess is you're not going to be the only one who's interested in this. I have seen these conversations and this work spread like wildfire. Once you start it, everybody goes, oh, this is the thing. This is the thing I was waiting for. This is the thing I was looking for. And so if you just start the conversation, maybe with one trusted colleague and go from there, then usually people get interested because everybody's looking for the answers to how to best help our kids.
Wonderful. Thank you. There is a question, and I think this would be great to remind people of what's happening in the next couple of weeks. The question is, are there any more trauma-informed trainings we can attend in the future or anytime soon?
Well, I mean, I know Caltrin does a lot, but in 2 weeks, I'm doing a trauma-informed leadership training. It's something I'm very passionate and excited about. So it's a bit more of an advanced version of this training, tailored for leaders. And we really dive into psychological safety from a team approach. I like to think we're talking about trauma-informed in a different way than maybe we've been talking about it before. So if you 2 weeks from now, we're going to be doing that, and we're going to be doing some follow-ups on that in the spring. And then I think there might be some other ones. I don't know, Jess, I'll throw it back to you for those others.
Absolutely. So there's 2 ways to find it. And there are some upcoming sessions through Caltrin, which I have dropped into the chat. But Caltrin also has a very robust archive. So if you did not catch a webinar April of last year and you're wondering if we have a recording, we probably do. And it's probably in our training archive. So I'm also going to drop that into the chat, because if there are any specific trainings that you might have missed, oh, thank you, it's in the chat now. If there's any trainings you might have missed in the area of trauma-informed care, that would be a great place to go for that as well. Other than that, I didn't see any more questions come through, but I do have a question for all of you. I'm going to wrap it up in a second, but I want you to think about the information that you have heard today, the notes that you have taken. What is the one thing that you're going to walk away really thinking about? If you had to say your greatest takeaway today, and there's a lot, but what is the one that you can say when you close today's session, it's really going to stick with you? Why don't you drop that into the chat? I'm always curious to know, what is your one takeaway, the one thing that stood out to you the most about today's topic? Safety makes a difference. Encourage and create the culture change. Absolutely. STS. Safety. Ways to make families and clients feel safe. Don't overpromise. Connection and safety. The video. Love the videos that Dr. Conradi chose for sure. These are wonderful. The 6 principles of being trauma-informed. Wonderful. Asking staffs what brings them energy in their work. Great. We're always curious to know, those ideas that come to you and inspire you. We're always curious to know what they looked like for you in today's session. And hopefully it only grows from there. So thank you for sharing these with me. These are great. So something that I want to give you a little reminder of. Following today's session, you will have access to a very brief survey. And that brief survey is going to give you a certificate of attendance. Haley has dropped that in now. We'll probably drop it in a few times because your wonderful takeaways are coming through. Also, as a reminder, in about 2 weeks, there is a leadership-specific conversation about trauma-informed. What does that mean? What is trauma-informed leadership? Balancing compassion and accountability. That's on August 17th. You are also welcome to sign up for that. And if you are curious about, gosh, this was a great topic. Where can I find more? What does that look like? Please note that you can either go to the caltrin.org website, or we'll drop that information in your inbox. If you want to sign up for our free newsletter, we send, I think, twice a month now, a recap of what's going on with Caltrin and upcoming trainings that you don't want to miss. Other than that, on behalf of Caltrin, we want to thank Dr. Conradi. Thank you for being with us again. We're so looking forward to the next one. And for participants, we appreciate all of your attention and your engagement today. And we can't wait for the next one. We got you out of here 2 minutes early. Go enjoy it.
Thank you, everybody. Thanks for joining.